A very good evening to one and all, and a warm welcome in this virtual event organized by Ayush Darpan Foundation and Ayurveda Welfare Foundation on the occasion of National Ayurveda Day. So we are here with the esteemed speakers, and I would like to invite all of you in this virtual celebration of Ayurveda Day. I welcome Dr. Manisha Chikhale from Mumbai, Maharashtra. Before starting the session, I would like to play Dhanvantari Vandana. So first we will go with Dhanvantari Vandana and then we will start the session.
शङ्खं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनम् मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्.
With this, I would like to invite our first speaker, Dr. Manisha Chikhale. She is professor in Prasuti Tantra department and she is working currently in Bhopal, Madhya Pradesh. So welcome ma'am on this platform of Ayush Darpan. And madam's topic is Uttar Basti. I think Uttar Basti is a very much interesting topic and it is a boon for Ayurveda gynecology. Uttar Basti cures many of the diseases and we are eager to listen about the Uttar Basti. So welcome ma'am and you can start your session.
Okay, thank you ma'am. Am I audible?
Yes, please continue.
Myself, Dr. Manisha Chikhale. Good evening to all of you. First of all, I wish to all happy National Ayurveda Day to all. I'm very thankful of Dr. Shilpa and Dr. Naveen sir for giving me the opportunity to speak on the topic Uttar Basti. First of all, we all go for the introduction. The Basti, ma'am, PPT.
Ma'am, can you on your video? So
yes, ma'am.
It will be good to see you.
My video.
Yes, yes.
Is there?
No. Just click on that stop video and share video. There are two options. You can near the mic. मॅडम दिसते का एरो पहा तिथे म्यूट आणि स्टॉप व्हिडिओ
अनम्यूट झालंय पण स्टार्ट व्हिडिओ होत नाही आहे.
तुम्ही मोबाईलवर
मोबाईलवरून ट्राय करते मी लॅपटॉप वरून जॉईन झाले.
मग तिथे तेच ऑप्शन तर सेमच असणार तुम्ही मोबाईल किंवा लॅपटॉप दोन्ही असेल तरी पण ठीक आहे हरकत नाही पण मग ऍटलीस्ट पीपीटी तरी शेअर करा.
येस माझं शेअरिंग
तिथे ग्रीन बटन आहे पहा शेअर म्हणून.
हा शेअर द स्क्रीन. येस
त्याला हे करायचं.
ओके आता येते मॅम.
नाही अजून नाही झालं शेअर.
मॅम तिथे इंडिकेशन येते होस्ट हॅज डिसेबल यू.
नाही करा आता केलंय मी ऑप्शन दिलंय तुम्ही करा.
ओके
येस आता झालंय स्टार्ट होईल. येस
मे स्टार्ट मॅम.
येस तुमचं ओपन करा पीपीटी आणि स्टार्ट करा प्लीज. येस, थोडं मी मॅक्झिमाइज करता का खाली त्याला, फुल स्क्रीन
हो.
करा. हा, त्याच्या बाजूला तिकडे तिकडे पलीकडे, नाही अजून पलीकडे. इकडे खाली एरो असतो पहा मॅडम, खाली तिथे ना हा असा ह्याच्यासारखा असा एरो असतो ना, त्याच्यावरती क्लिक करा. त्याच्या अलीकडे तुमचं हे इथे हा
व्यवस्थित.
वॉल्यूमचं असतं ना, त्याच्या अलीकडे आहे. हा करेक्ट, तिथे काय. येस.
First of all, we are going for the introduction. Uttar Basti. The Basti administered through the Uttar Marg and has a Sarvashreshth Guna is known as the Uttar Basti. According to Vangasen, Uttar Marg means the Mutra Shukra Marg in the male and the Mutra and Yoni Marg in the female. According to Bhav Prakash, the Basti, which is administered after the Niruha through urethra, is said to be Uttar Basti. The main indications for the Uttar Basti are infertility, fallopian tube block, thin endometriosis, adenomyosis, uterine fibroid, low AMH, DUB, habitual abortions, and anovulation. The time of administration is Strinam Artaukalam tu Pratikarma Tadacharit. That means in female, Ritukal is the most suitable time for the administration of Uttar Basti. Uttar Basti should be administered just after the menstruation has stopped. In male, there is no specific time described by the Acharyas. Uttar Basti Karma Vidhi mainly includes the three procedures, that is Purva Karma, Pradhan Karma, and the Paschat Karma. The instruments are arranged in the Purva Karma, and the instrument needed are gloves, surgical mask, sponge holder, Sims speculum, rubber catheter, or IUI cannula, or the feeding tube, disposable syringe, cotton gauze pads, and the towel clips, etc. In Purva Karma, we are going to prepare the patient for the procedure. In case of male, the local Abhyanga and Swedan is applied. In case of male, the
मॅडम, मनीषा मॅडम, यू मे
Yes,
स्पीक
sir.
इन हिंदी. हिंदी मध्ये बोललं तरी चालेल, कारण सगळ्यांना ते जास्त सोपं पडेल, हे की नाही.
okay. The patient should be brought to the Basti room and advised to sit on the stool having the height equal to the knee of the patient. Then the Basti yantra containing Vat or Sneha is indicated in the urethral meatus. The urethral meatus and the Basti netra should be lubricated with the Sneha. Then remove the netra by leaving some oil and the put pak. But in case of female, there are special three procedures, that is Purva Karma, Pradhan Karma, and Paschat Karma are mentioned. In females, the Purva Karma includes Abhyanga, that is Snehan by oil. It has a Vatashamak and Vatkulanta action. It also relaxes the pelvic organs. This should be followed by the Swedan. Swedan means hot fermentation. It also carried out on the same parts as that of the Abhyanga for 10 minutes with the hot water bag or Nadi Swed. It relieves the stiffness and pain in the pelvic region. Both Abhyanga and Swedan increases the blood supply to pelvic organ. Hence, it helps in absorption of the drugs and the pain during the procedure. This should be followed by the Yoni Prakshalan. Yoni Prakshalan should be done by the Nimbakwat or Panchavalkalkwat. It is most effective thing which maintain the sepsis and decrease the risk of infection. In Pradhan Karma, mainly the patient should lie in the lithotomy position and the steamed speculum is introduced to retract the posterior vaginal wall. It is followed by the anterior wall retractor in order to visualize the cervix. Then apply the valsalum to hold the anterior wall of the uterus, lip of the cervix. Then Remove the anterior lip of the cervix and retractor. Use uterine measure length to uterus and as a dilator. Use Hager's dilator to dilate the os gradually. Then insert the rubber catheter, IUI cannula, or the feeding tube. Then inject the medicine, which is autoclaved and warmed, very slowly. Make sure there should not be a rubber bubble in the cannula or the syringe. Keep the head low position of the patient. In Paschat Karma, rest for the some time is advised. As for the diet intake is concerned, Acharya suggests that after the Pathyagana of Uttarbasti at the evening, the patient should be given Mansras, Payas or Yush. In Paschat Karma, mainly we are looking for the medicine, keep sterilized gauze piece in the vagina, remove valsellum and spin speculum. There should be head low position for the 15 minutes. Now the medicines mostly used in the Uttarbasti and the doses of the medicine. Approximately 5 ml of growth or tail is injected. In case of infertility, Falagrowth is used. In tubular blockage, Ksar tail is very useful. Anovulation cases are solved by the Narayan tail. To promote the thickening and endometrium, Bala tail is used. In habitual abortions, for the implantation failure, Dhanvantar tail is used. In PCOS, Kasi Sadi tail is very effective. In case of DUB, that is dysfunctional uterine bleeding and menorrhagia, Shatavari tail is very useful. As for the diet intake, very light diet is suggested for the patient. That means Yavagu, Yush or Mansras. Uttarbasti is a sophisticated scientific Panchakarma practice for all genital and urinary system. Present fortified method of Uttarbasti ensures the result by quick and effective target reaching method. Uttarbasti is also used for the infertility in female and has a better result for the procedure. I'm very thankful of the total entire team for giving me the opportunity on that platform. If there is some doubts or questions, are welcome. Thank you, ma'am. Hello, am I audible?
Yes, ma'am.
Finally, the conclusions, the utility of natural pathways to reach the target of Ayurvedic medicine. Present fortified method of Uttarbasti ensures the result by quick and effective target reaching method. Thank you.
Thanks, ma'am. If there is any question, you can ask. Any questions? Doctors, any questions? You may ask directly and please put it into the chat box.
नमस्कार मैम।
नमस्ते।
मैम मेरा एक प्रश्न था कि मैम एक फाइब्रॉइड की पेशेंट है और उसको ब्लीडिंग बहुत ज्यादा नहीं है, तो क्या मैं उसे लेखनीय द्रव्य जैसे कि अपना कांचनार है, वरुण है और त्रिफला, शिग्रू, पुनर्नवा आदि जो औषधियां हैं, क्या मैं इनसे तेल निर्माण करके और उसकी वस्ती दे सकती हूँ?
उत्तर बस्ती में आप प्रेफरेबली 5 ml तक हम लोग क्वांटिटी यूज करते हैं, तो यू कैन गो फॉर दैट इफ देयर इज नो इरिटेशन एंड हेवी ब्लीडिंग. If there is a irritation and heavy bleeding, first of all, according to my opinion, you should go for the pichu, vaginal pichu.
जी मैम, थैंक यू मैम.
Welcome.
मैम एक मेरा प्रश्न ये था कि while using उत्तर बस्ती हम लोग मिनिमम कितना डिस्टेंस मेंटेन करेंगे इन पीचू, इन धावन, इन उत्तर बस्ती और इन मात्रा बस्ती, Or can we combine Uttar Basti and Matra Basti?
Yes, ma'am. Actually, first of all, we are going for the Niroha Basti. Then after on the same day, after half an hour, we will go for the Uttar Basti Karma. And before the 10 minutes, after the 10 minutes of Yoni Prakshalan, you can directly go for the Uttar Basti Karma. And after Uttar Basti Karma and 15-minute Yoni Pichu is should be put there. And after the 15 to 20 minutes, you can go for the Matra Basti, but patient should be lie down for the half an hour after the procedures.
Okay, ma'am. Thank you. Any more questions? Okay, ma'am. Thank you very much. Actually, it's a really interesting topic, Uttar Basti. Okay. And every time it is necessary for Yoni Prakshalan as a
Yes,
Purva
ma'am.
Karma?
Yes, ma'am. Because Yoni Prakshalan maintain the hygiene and decrease the chances of contaminations.
Yes.
It
yes.
is better to go for that because vaginal path is many a time it is infected, or there may be a white discharge or some unwanted discharges that will be washed out by the Yoni Prakshalan.
Okay, ma'am. Actually, text
Panchavalkal cloth is very safe.
Yes. Okay. टेक्स्ट में तो क्लासिकली क्वाथ से भी हम लोग उत्तर बस्ती दे सकते हैं, बट प्रैक्टिकली बहुत कम लोग देते हैं.
Yes, ma'am. I have tried 2 or 3 times, but all the cloth is just repel out with
Yes,
that
yes.
force when we give. So it's better to go for Yoni Prakshalan. It's done the half procedure like
या
that.
हाँ हाँ, मतलब
And
जो
then
हमारा पर्पस है वो सॉल्व हो जाएगा. We can
yes,
solve our
ma'am.
purpose.
और
and
एब्सॉर्प्शन ऑफ मेडिसिन भी बढ़ता है जब हम लोग 5 ml के करीब में ऑयल या ग्रोथ इंसर्ट करते हैं, तो योनि प्रक्षालन होने की वजह से वहां से इन्फेक्शन तो रिमूव आउट होता है और वहां के जो ऑर्गन्स है वो भी रिलैक्स हो जाते हैं, जिनको ब्लड सप्लाई इंप्रूव होता है.
Yes.
तो मेडिसिन का एब्सॉर्प्शन करने में और पेन रिलीविंग में काफी इफेक्टिव होता है.
ओके मैम. और डिस्फंक्शनल यूट्राइन ब्लीडिंग में कैन वी यूज दिस उत्तर बस्ती?
यस मैम. डिसफंक्शनल यूटेराइन ब्लीडिंग्स में नारायण तेल और शतावरी आदि ग्रोथ का काफी अच्छा रिजल्ट है. विद
ड्यूरिंग द हेवी ब्लीडिंग कैन वी यूज दिस?
Shatavari Adi Growth has a very good result. Even I suggest after Uttar Basti at the night time, Yoni Pichu of the Shatavari Adi Growth.
Yes. Okay, ma'am. Thank you very much. Any more questions? Dr. Sucheta, Dr. Shashi, if you would like to interact?
मैम नमस्ते, गुड इवनिंग. मैं उत्तर बस्ती नहीं करती मैम.
अच्छा.
Ma'am, just try it out. It has a very good results in the practice.
मैम लेकिन एक डर है कि ओटी जैसा जब तक नहीं रखते हो सेटअप तब तक उत्तर बस्ती प्रॉब्लम कर जाएगा, इसलिए मैं नहीं करती.
Okay. Actually, there is a small autoclave machine which we can handle it in a OPD basis also.
ओके मैम, थैंक यू मैम. मैंने सेशन तो अटेंड करे हैं गायनी के लोकल ट्रीटमेंट वाले, तो मैं कुछ ही चीजें करती हूँ.
At least Yoni Prakshalan and Yoni Pichu can try. It has also very good results.
वो सब करती हूँ मैं, वो सारा करती हूँ.
Okay.
Okay.
ओके मैम, थैंक यू.
Thank you very much. Moving with this, our next speaker, I would like to invite Dr. Sonali Dhumare Mandekar. Dr. Sonali is working currently as a professor in the Department of Kaumar Bhrutya in Gondia, and it's really interesting topic. She is coming with interesting topic, mobile addiction in children's, its effects and modules or formalities or treatment module. She will explain very neatly. So please, doctors, have a kind attention. And Dr. Sonali, you can start your session.
Good evening, one and all. Am I audible?
Yes, 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 please.
First of all, greetings to all of you for National 8th Ayurveda Day. This is Sonali Dhumare from MS Ayurveda College, Gondia. Here are my sincere gratitudes to Ayush Darpan, Dr. Naveen Joshi sir, and my friend Shilpa Yerme madam, who give me an opportunity to present myself for the celebration of Ayurveda Day series. Thank you very much. So my topic is mobile addiction. Can I share my screen?
Yes, yes, please, please. Yes, yes, ma'am.
Is
It's
my
visible
screen visible?
and you can maximize it.
Yes, ma'am. Wait 1 minute. Okay.
Yes, please continue.
So my topic is mobile addiction and its effect on mental health and remedies in children. Nowadays, because of easy communication, safety purpose, peer contacting during their schools, tuitions, for doubts, and digitally equipped, it boosts creativity and helps in primary education, and it is a best information access and entertains also. Because of these, mobile phones are nowadays are integral part of everyday of everyone. See, our theme for Ayurveda Day is Ayurveda for every day for everyone. So mobiles also here for every day for everyone. It has become an important organ in body, just like heart or brain. Mobile phones emits radio frequency energy, a form of non-ionizing electromagnetic radiation, which can be absorbed by tissues close to the phone. The amount of radio frequency energy a mobile phone uses is exposed depend on many factors, as the technology of the phone, the distance between the phone and user, the extent, type of mobile phone use, extent कितनी देर तक फोन यूज किया जाता है, and users distance from the cell phone tower. In slide we can see there are so many children, they are together with their friends, but they are not talking to each other, they are just watching their phones, they are doing chatting, singing, taking selfie, playing games, doing work, but they are not happy, right? So International Agency of Research on Cancer, IARC, made a statement that possibly carcinogenic mobile is, but there is no evidence for this, that but nowadays increasing cases of cancer and brain tumors are more. Additional research should be done on this particular long-term use of mobile and its relation to cancer. So chronic phone overuse is proven to change reward circuits in brain chemically. See, first of all, we see sign and symptoms of nomophobia. What is nomophobia? This is addiction of mobile. No mobile phones. What are signs? Lying about smartphone use. Matlab, they are using smartphones for hours, but telling that I am not using it. Not expressing to loved ones concern, neglect or trouble completing duties at work, school or home. They are not completing their homework, doing exercise. Then more and more time using a phone, checking profiles repeatedly due to anxiety, accidents or injuries due to phone use while driving or while walking on road. They are playing on mobile, so there are accidents are happening. Working later to completing tasks, matlab, they are ignoring their primary work or primary duties. Weak or non-existent social life, there is no social life. Fear of missing out. again, isolation from loved ones, a feeling of love, and getting up the more fans think of, of sing, not
I think Dr. Sonali has left the meeting due to internet. Yes. I think internet issue, Dr. Sonali. So you may share again. Dr. Sonali, are you able to share?
Am I audible?
Are you able to share?
Yes, I can.
Okay.
I will rejoin the meeting once again.
Dr. Sonali, are you there?
Am I audible now? Yes.
Yes, maximize.
Am I audible?
Yes. Slides are visible. Just maximize it and you can continue your talk.
Am I audible?
Yes, yes. Yes, yes, continue, please. मी करते शेअर सोनाली. तू बोलशील फक्त, तुला हे होत नाहीये तर मी शेअर करते. सोनाली, डॉक्टर सोनाली.
Am I audible?
येस येस, थोडा मोठा आवाज अजून येऊ दे. आवाज आवाज नहीं आ रहा है, आवाज नहीं आ रहा है. अनम्यूट कर, अनम्यूट. हाँ.
Slides are visible?
यस यस, मैंने किया है शेयर, आप करिए.
Okay. So how this addiction takes place? Chronic phone overuse is proven to change reward circuits in brain chemically. One of primary affected neurotransmitters is gamma aminobutyric acid, that is GABA. This is an inhibitory neurotransmitter that produces a calming or euphoric effect. It can even control fear and anxiety. This inhibitory neurotransmitter plays a significant role in addiction by rewarding substance use and reinforcing addictive behaviors. When we give cognitive therapy, when addiction decreases, this gamma production increases and patient becoming normal in behavior. Next slide. Next slide, please. While on-screen time, mobile light from mobile screen also affect eyes and brain. That induces headaches or migraine attacks and worsen pain on other symptoms, lead to eye fatigue and pain, both indicators of computer vision syndrome, suppress melatonin production, which can lead to disruption of sleep, cause damage to retina of your eye, and contribute to other eye disorders. Am I audible?
Yes, yes.
See, here kids are also not playing, but they are on active on their mobile. Negative effects of phone addiction are sleep deficit, lower concentration, creativity blocks, aggravated ADD, attention deficit disorder, anxiety, cognitive, loneliness, security, impaired relationships, grades, and psychological problems. Treatment for phone addiction is group therapy. Cause just like grandparents and friends in to tell us a lot of stories, but these ग्रुप सपोर्ट्स, साइकोथेरेपी. ग्रुप सपोर्ट में जैसे एडिक्टेड लोगों के ग्रुप्स रहते हैं, ड्रग एडिक्टेड, डायबिटिक लोगों का ग्रुप, तो वो एक दूसरे को सपोर्ट करके एडिक्शन से एक दूसरे को बाहर निकालने की कोशिश करते हैं, जस्ट लाइक दैट साइकोथेरेपी मोटिव एम आई should I repeat previous slides? Hello. Hello. Should I repeat previous slides?
Yes, ma'am.
Should I repeat previous slides? Treatment for phone addiction, that is called as Achar Rasayan and Nidan Parivarjan Chikitsa, cognitive behavioral therapy, group therapy, counseling by teachers, elders, grandparents used to tell us stories, group supports by other addictors, phone addict friends, psychotherapy, motivational interviewing, medication assisted treatment. Next, do's for parents. In Ayurveda, Nidan Parivarjan is the half winning treatment, half winning battle treatment. So Nidan Parivarjan and Achar Rasayan, break time, give break after every 30 minutes, have a stroll, just have a little walk or in your garden or stretching of body. Prioritize your tasks, just like homework, studying, housework. Create a media plan. Watch selected videos, games on media. Don't use a smartphone as a reward or distractions. This is usually seen that parents offer, I will give you phone for 1 hour if you study for 2 hours. This is wrong. You should not do like this. Indulge them in activity learning. Strict time schedule for smartphone. Encourage face-to-face communication. Ask them to go to their friends and talk with them. Be a role model. See, kids are just like tissue paper. They absorb whatever you do. They watch your actions and they learn from your actions more than your words. Create bond with children. Encourage playtime, active supervision. Don't use the mobile phone as emotional pacifier during feeding, dressing, etc. Ayurvedic treatment therapies are Shirodhara, that is pouring medicated cloth or oil on head and forehead. Shirobasti, holding oil on the head, that likes in a pot. Shiro Abhyanga, head mask. Contains face massage with, then put 1 drop in each nostril with of Anutel or Panchendriya Vardhan tel. Shiro Pichu, putting cotton soaked in medicated oil on head. Gantush and Kaval, oil pulling of til tel or medicated oil or Mansaras. Pada Abhyanga, that is food massage. Foot massage. Chandan tel, til tel, coconut oil or almond oil can be used daily for Pada Abhyanga at bedtime. Sarvanga Snehan, bad postures, we should do Sarvanga Snehan to correct it. Next, treatment with medicine is first of all late night watching mobile. Kids are watching mobile in late hours of night, so their biological clock get completely disturbed and constipation and loss of appetite. So first of all, correct digestion, correcting bowel habit, that will also increase appetite. eating healthy food. So pills and bottles should not be more than your lunch or lunch box or dinner. So in Ayurveda, every day Ayurveda for everyone. So ahar is called as Mahabheshaj in Ayurveda. Give them nuts, almond, and healthy food that secretes serotonin and tryptophan like happy hormones. Drinking a lot of water. We know that there is 70% water in our body and 90% water in brain, and children usually avoid to drink water in while playing games or doing their activities. We can give medicines as rasayan therapy. See, Pancha Saraswati Panchak. It's the name itself indicates that it's a Medhya Rasayan, which five? Brahmi, Shankhapushpi, Jeshtamad, Vacha, and Shatavari. These are. Am I audible? Am I audible?
Yes, yes.
हाँ. Pancha Saraswati Panchak is Brahmi, Shankhapushpi, Jeshtamat, Vacha, and Shatavari. These are Medhya herbs can be commonly used, and other commonly used herbs are Amalaki, Ashwagandha, Shankhapushpi, Jyotishmati, Jatamosi, Tagar, Triphala. I want to say that we know Amalaki, you can use achar, Avla achar, you can use Kushmanda, Kora, that is a very common vegetable in Maharashtra. We can use it for lunch box. So for eyes, blinking of eyes in between screen time, Anjan, use of kajal, that is very common. Kajal is a homemade with Bhimseni kapur, pure cow ghee, and with utensil of copper. Ashwatan, holding medicinal oil or cloth on eyes. Because of blue lights and mobile, there is drying of eyes and damage to retina. That's why we have to do all these things. Eyeball exercises, keeping slices of cucumber or pads soaked in Godugdha on eyes, at least 8 hours of peaceful sleep. Diet healthy for eyes health, that is vitamin A rich, carrot, eggs, milk, fish, etc. For ears, minimize the use of headphones. Karna Puran by Panchendriya Vardhan Tel, Bilva Tel, Padabhanga and Shiro Abhyanga is very essential for it took 1 or 2 minutes in your daily routine, but they give a lot of benefits to your health and in long term. So Padabhyanga, you can see pictures of Padabhyanga. You can we can massage our foot by a bale metal, कांस्य धातु से घी से पैर के तलवों को मसाज करना चाहिए. This is Shirodhara and Shirobasti, Shiropichu of medicated oil or cloth. Next is Nasya. We can put one in each nostril, or instead of putting oil, you can just dip your finger in oil and just rounded it inside of each nostril. Here kajal practice is original traditional kajal practice is vanishing, but that is very much important. These are Ashyotan and Tarpan Chikitsa for eyes. This is Gandush and Karnapuran. I want to say one thing. A boy of 5 to 6 years was mobile addicted, and he was unable to speak a complete sentence of only 4 to 5 words because of mobile addiction. We gave him Gandush Chikitsa of oil, simple oil, til oil, and gradually he can talk well. So Gandush Chikitsa is also important. So this is all. Thank you. Thank you very much. At the end, all said and done. With all hazards happening in our life, there is answer for everything in Ayurveda. So let us cheer up for Ayurveda for everyone, every day. Thank you.
Thank you, Dr. Sonali. Thank you very much. It was really nice. PPT was very nice. So thank you very much. Are there any questions, doctors? Any questions? I would like to ask one question. What you recommend for your child to prevent from mobile addiction?
I recommend I told you that we are children are just like tissue paper. They absorb what you do, and action speaks louder than words. If I read books, then my children also read book. If I chant mantras, they will also. If I do meditation, they will also do meditation. If I sing, they will also sing. If I go to playground, they will also go to playground. This is as a parent, but I want to say, and I request to all of audience that Shiro Abhyanga, Pada Abhyanga, Karna Puran, Nasya Puran. Instead of Nasya, we can do Nasya Puran. These are common practice in India. But nowadays, with modern era, they are disappearing. And our regular or ancient traditional food is also well planned for health. We should follow it.
Yes, ma'am. Yes, definitely. Any question, doctors, from your side? Anyone wants to ask or interact with madam, as she is expertise and working from last 20 years. Dr. Ratna, please.
Hello, good evening, everybody, and Dr. Sonali. Very, very nice session you have conducted. And your last sentence really touched my heart. That is, actions speak louder than anything in the world for children. Thank you very much. Thank you, Doctor.
Not only for our own children, this is true for our students also. So if we do, then our students will also do.
Yes, yes, indeed. And Dr. Shilpa, thank you for such a nice program you are conducting. Thank you.
Yeah.
Good night.
Okay, ma'am. Okay. Any more questions? Okay, thank you, Dr. Sonali. Thank you very much for your efforts to make the program successful. And at the end of session, I would like to invite Dr. Pranjal Joshi with the topic, a very different topic, diet or nutrients for athletes. So welcome, Dr. Pranjal. Please.
Thanks to all. Thanks to all. Cheer up for Ayurveda Day and happy Diwali, all of you.
Yes, ma'am. Yes, thank you.
Thank you. Thank you very much.
Ma'am, wait a minute. I am sharing the slide.
Yes, yes, please.
Very Hello, everyone. Hello, everyone. Myself, Dr. Pranjal Joshi. Today I'm going to talk about food, essential fuel for athletes. Uh, I have pursued my master's in musculoskeletal and sports in physiotherapy, and I'm also a PhD scholar. So, what is nutrition, and why nutrition is important in athletes? So, nutrition is the determinant in achieving adequate sports performance, defined by three variables: timing, training, rest, and feeding. So, why do we need certain amount of specific amount of food or fruit to enhance the sports performance? It is to give the micronutrients and macronutrients to the every muscle fibers, as well as joint, bone, blood vessels, as well as the each and every cells of the human body, to make the sports athlete to perform more properly and more adequately in the event. However, the main objective of sports nutrition must be preserving the athlete's health, which can be achieved with an adequate intake adapted to the type of training performed. Two aspects that can limit the sports performance are the state of hydration and energy contribution. So, why hydration is necessary? As body needs fluid or liquid diet or any liquid to keep on going to perform any task, the water or any type of fluid intake helps the muscles to regrowth or regenerate their cells, specifically to enhance their performance. Hypohydration states produce alterations in homeostasis, decreased blood volume, increased heart rate, lower rate of sweating, increased organism temperature, and greater perception of effort, which translates into sports performance deterioration. So, what is the benefits of sports nutrition? The ideal diet for an athlete is not very different from the diet recommended for any healthy person. Why is that? As the person or athlete has to perform differently and has to improve their joint range of motion as well as their muscle groups to improve the sports performance. So, as we can take the example of runners. As we see that the runners uses their legs mostly, but not just their legs, their whole body is consumed. Their energy drains very easily. So to conserve their energy and to make them perform for longer duration of time, the nutrition which we provide to the sports person or athletes has to be specified that they have to store the energy in their body in the form of calories and other nutrient factors like fat, protein, vitamins, minerals, and carbohydrates. So 10 things what you should know about sports nutrition. Look beyond weight. It is not necessary that nutrition has to be based upon the weight, whether to be gaining weight or losing the weight. Building muscle takes more than just protein. Don't take protein supplements like from chemical based protein supplements. It always harms you. Protein, it's not just more, but when and how much. Infrequent meals cause problems. As an athlete, you can see that the athletes sometimes they keep on fasting. They think that they fasting or irregular diet can also make their muscle mass grow. Fresh foods help the microbiome keep you healthy. Good food, bad food, wrong choices. As the recent study suggests that the vegetarian diet increases your body capacity of storing the energy compared to non-vegetarian diet. The logic is that the food supplements which you take from non-vegetarian diet, I'm not neglecting or any producing any kind of controversial statement. I'm just stating a fact according to research articles. that the supplements which we are taking through non-vegetarian diet is going via pure vegetarian things, supplements like grass, leaves, sticks, or any other living green supplements, like any other plant-based products. The non-vegetarian things which we take are just like a broker thing. The main person who gives the direct supplement is being cut out, and it is reproduced through the plant-based to animal-based, and then from there we cook and take the animal-based products, which does not help much more compared to pure plant-based diet. So it can affect the sports performance in a way, directly or indirectly. Relative energy deficiency is sport can be reduced. Poor hydration, poor performance. Recovery from exercise is just as important as exercise, which means the recovery nutrition like dry fruits, recovery drinks, some small amount of fruits or something, some supplements can also help from recovering from the sports injuries. It is also important to learn how to lower your stress. The nutrition which we provide to the athletes can also be based upon the timing of the stress level, anxiety level, and depression level, which reduces their all the three affecting factors and improves the athlete's performance. So, what is the benefits? It enables you to train longer and harder, delays onset of fatigue, maintains a healthy immune system, enhances performance, improves recovery time, improves body composition, reduces potential of injury, helps with focus and concentration. So what is the energy needs in athletes? The energy needs in athletes is the composition of the timing during their practice and the timing during their competition or tournament season. So the nutrition should be based upon that body basal metabolic rate as well as body mass index. So what is basal metabolic rate? It is the metabolic rate which helps an athlete or person to overcome their deficiency according to their requirements. So if an athlete is performing some task like such, we are talking about runners, so we will go upon runners only. If an athlete, a runner is asked to perform 100-meter dash in a specific given time, such as moderate time is 10 to 12 seconds. So if an athlete is given that he or she has to perform the task within 15 seconds first, then slowly reduce their time. So to improve their timing as well as their energy expenditure, we have to give the supplements according to that. As we can see in this photo, that's basic needs is basal diet. In this basal diet, plant-based products, raw animal products is given to the sports athletes to improve their regeneration of the cells. Then, according to needs and according to government norms or so some rules and regulations according to drugs and doping thing, we can give the specific sports nutrition in base of supplements and then dietary supplements if there is not enough supplement going inside through plant or animal based products. So as I have said earlier, that hydration is very necessary in sports athletes as they have to recover the shrinking of the cells. So how do we calculate the hydration level in the sports athlete? is in this chart. We can see that weight before the activity and weight after the activity has been calculated with weight loss, how much weight loss has been seen, and then calculated in duration of exercises in hours. Same as after giving the water, before giving water, what amount of weight have we seen, and then after the activities, what amount of weight we can see, is the volume consumed and urine loss. So to calculate this whole rate of sweating, we can see that the weight loss plus volume consumed, fluid or any other liquid diet is being consumed, minus the urine loss divided by duration of exercises, gives the sweat rate per liters per hour. So why do we calculate this? To check and make the specific amount of nutrient protocols to enhance the performance of the athletes. What to know about micronutrients? Why micronutrients are essential? Micronutrients are helps in building up of the body cells and DNA enhancing supplements, which helps the athletes to overcome their hunger during the physical activities they are performing. So as we give them macro or micronutrients, they their cells overcome their hunger, and then they can perform or expand in their energy level. In this chart, we can see that vitamin C, vitamin B12, vitamin A, calcium, B6, and vitamin D are most essential for the sports athletes. Protein, which are made up of individual amino acids, serve as your body's building blocks. They help build everything from muscle to skin, bone to teeth. Carbs are your body's preferred energy source. They fuel your daily functions from exercising to breathing, thinking, and eating. For most people, fats are the body's supporting and or secondary energy source. If the carbohydrates are expended very much, or you have lost carbohydrates, the body functions over your fatty cells. In selected cases, such as keto-adapted athletes, they will provide a larger portion of daily energy needs. So what should be the athlete's diet? An athlete's diet should be similar to that recommended for the general public, with energy intake divided into 45% of 45% to 65% of carbohydrates, which is the main source of their energy, then 15 to 25% of protein, which is the main source of their muscle regraining or muscle bulk gain. 20 to 35% of fat is to back up the energy sources, which in case of overexertion of the athlete, this fat helps him to regain the energy. Athletes who exercises strenuously for more than 60 to 90 minutes every day may need to increase the amount of energy they consume, particularly from carbohydrate sources. Guidelines for carbohydrate and protein based on grams intake per kilogram of body weight are also available. The current recommendation for fat intake are for most athletes to follow similar recommendation to those given for the general community, with the preference for fats coming from olive oils, avocado, nuts, and seeds. Athletes should also aim to minimize their intake of high-fat foods such as biscuits, cakes, pastries, chips, and fried foods. Nowadays, the trends of pizza, burger, and other junk foods are more seen in athletes, due to which the athletes are unable to perform or reach their target given to them in a specific given time. So in this, we can see that I have given a case of elite marathon runner. For elite marathon runner, the principles of sports nutrition change slightly. Why is that? because they have to run for a longer duration of time, longer duration of kilometers, and they require more and more amount of energy to overcome the distance they are taking. So what we can give? We can give the glycogens, carbohydrates stored, uh, carbohydrate-rich glycogens in their food products. So to manage their body intake, 65% of carbohydrates, 25% of fat, and 15% of protein can make them run more and more longer distance compared to normal athletes who run over to 100 to 200-meter dash or 400-meter dash or 400-meter relay race. You'd need to take in more fluids to avoid muscle fatigue and increased injury risk. The hydration technique which we provide to the athletes is much more necessary to overcome the challenges of fatigueness of their muscles and to overcome the releasing of lactic acid in their muscles, as you risk losing more fluids through sweat. Finally, recovery strategies would be even more important for a marathon runner, as training more means there would be less time between sessions, meaning less time to recover. So the recovery nutrients should be provided to the athletes or marathon runners during their event. This would mean having a carbohydrate protein rich snack within 30 minutes of finishing a training session, such as banana with a protein shake, or you can also give protein bars according to their needs. Thank you so much. Is there any question you want to ask regarding nutrition among athletes? Am I audible, ma'am?
Yes, yes, please.
Thank you so much, ma'am.
Dr. Pranjal, have you completed with?
Yes, ma'am, I have completed my slide.
Yes.
Yes, ma'am.
Okay, thank you very much. Thank you.
Thank you so
Very
much, ma'am.
nice. Any question, doctors? If any question, you can ask. So I think no questions are there. So thank you very much, all the speakers.
Thank you so much, ma'am.
Dr. Manisha, Dr. Sonali, Dr. Pranjal. It's really nice. Today's all sessions were really great and with very different approach. All of you had done a very great job. And thank you very much from Ayush Darpan Foundation and Ayurveda Welfare Foundation. And we will meet again. Hope. Thank you very much. Thank you.